told me 40 years ago when I was in medical school that I would be communicating on a daily basis with a group of educators here in Leipzig using something called a tablet that looked like this, I would not have believed you. Technology has allowed us to do some amazing things, and it has really changed the practice of medicine. This was certainly true for me in my practice as a heart surgeon. The advances in medicine continue to attract many new people to the field. Do you know that there are many more people that want to get into medical school every day than there are spots to accommodate them? And despite having all these people that want to be doctors, we still have a global shortage of them. And countries with critical shortages are shown here in red. And the rest of the world is underserved as well, including the US and Canada. The main problem is seen here. We're educating students in places that already have plenty of physicians, not the undersupplied areas. And in the better supplied countries, med schools are almost always in urban centers, not in the rural areas which need them the most. And the problem only gets worse. It's predicted by 2035 that the shortage of healthcare workers in the world will be 12.9 million. You may be thinking this doesn't affect you. Living in this wealthy economy, you probably already have pretty decent medical care. But think about it from a service perspective. How often have you had to wait to be seen by a doctor in an office or a clinic? And then ask yourself this: would you go back to a restaurant if they made you wait for 2 hours for your table, even though you had a reservation? Medicine is not a very effective service industry. And in poor countries, the problem can be far more serious. I make frequent visits to Jamaica. I was actually just there last week. The nice young lady who rents cars at the airport wasn't at the counter when I last visited. So I asked where she was. She'd had a cough. She didn't want to see a doctor because it takes a long time. And I'm not talking about an hour or two wait. In Jamaica, you can often wait 6 or 8 hours. For her, that means she loses a whole day's pay. So she didn't see a doctor, and her cough got worse. And finally, it was so bad, her friends took her to the hospital, and she had advanced pneumonia. But the worst part of this story is that she's not going to be back working at the rental counter or anywhere else, because I found out she died at age 30 of a pneumonia just because she didn't have reasonable access to a physician. So we know we have lots of students who want to be doctors, and yet we have a physician shortage. So why haven't we trained more doctors? And while the practice of medicine has changed tremendously, the way medical students are taught has changed little. For the last 2,000 years, medical students have had to travel to the few learning centers with great teachers to be educated. There's a depiction of Hippocrates teaching his students here. And that's not very different from how I was taught when I attended medical school at Johns Hopkins. You can see the lecture hall where I attended classes. This model is expensive, inefficient, and inaccessible. The average debt for U.S. graduates is $190,000. It's a big bill, whether the student is paying for it or the government. But you know, if the student isn't paying for it, your taxes are. So despite being trained in the leading universities in the U.S., it was actually a visit to the small island nation of independent Samoa in the South Pacific, which helped me find a solution to this problem. If you're uncertain as to how bad the global shortage of physicians is in the world, Samoa will put this in a whole new light for you. They had only one doc for 10,000 people. You may remember from the global slide that the U.S. has 25 times as many, and Europe even more. If you needed care, you were lucky to be seen by a nurse. So 12 years ago, I was asked to organize a medical curriculum which would be computer-based and delivered by something relatively new at the time called the Internet. The aim was to allow students who, for economic or geographic reasons, did not have access to traditional medical schools to become fully trained physicians. My first reaction was this would never work. But the more I thought about it, the more I realized how much sense this made. The same basic sciences need to be taught in all medical schools. So why duplicate this effort over and over? Shouldn't the same high standards apply throughout? Wouldn't it make sense to have a standard teaching platform to deliver the didactics? I thought this was such an intriguing proposition that I accepted a position to be dean of this program and help this program go through its first successful accreditation process. We started the first successfully accredited medical school that not only trained local students in the South Pacific, but simultaneously on multiple continents. And we did this in a way that was cost-effective. It was most affordable. And as the school became established, a remarkable thing happened. Not only did locally educated students become doctors, but by creating a teaching environment, the local doctors became teachers themselves. And this, in and of itself, improved quality in sustainable ways. Seems intuitive that if you have eager students asking probing questions, you're going to be sure you have the latest answers. And it was also amazing to me that we could educate students this way in multiple locations around the world. So I left Samoa realizing that it no longer made sense for students to travel long distances to the few esteemed medical schools they could get into, but that medical education could and should be decentralized and made widely available. It would be made available where it was needed most. Yet today, medicine is still taught in relatively few select schools located in major urban areas with distinct faculty teaching the same courses the same way they've been teaching them for most of the last 100 years. And students that can't get into these schools often just give up. So just as going from heart surgery in Baltimore to medical education in Samoa was an unexpected shift for me, so is my being here in Leipzig today. I am here because I became aware of a remarkable group from Leipzig that had built a company called Lecturio. And they had the same vision I had, to create a high-quality education platform and to provide medical education to underserved areas where it's needed most. So we joined forces, and now you know why I have daily calls to Leipzig. This new approach uses scientifically supported modern teaching techniques, such as presenting the material in short, well-illustrated videos, and interspersing recall questions, which are tracked and sent back to students at intervals driven by an adaptive learning algorithm. It includes a complete tracking system, so teachers can follow student progress and address problems as they arise. Most medical schools still use 1-hour lectures. TED Talks are limited to 18 minutes. And the learning science suggests that talks should be limited to 10 minutes and interspersed with recall questions. So, in that mode, let's take a break, and I'm going to give you the question of the day. But don't worry, we'll keep it easy. What is the best way to fix the global shortage of physicians? All right, let me see a show of hands. Who wants build more medical schools in urban areas? How about use modern educational platforms to allow medical education to be delivered cost effectively to underserved areas? Yay! And nobody wants C on this kind of a hot day. I appreciate that. So platform-based learning has been used now in over 175 countries by over 500,000 students. And one of those countries is Jamaica. The school there is called the All-American Institute of Medical Sciences, or AIMS. It was started by an immigrant surgeon who arrived with little more than a suitcase and a medical degree. He found a significantly understaffed healthcare system and set out to remedy the situation by establishing a medical school in a remote, underserved part of the country. He felt that by using these modern educational tools, he could take average students who had little preparation and turn them into outstanding physicians. Doing this in such an underserved area was truly unprecedented. I was so impressed by what he'd created with mere grit and determination that I accepted his request that I serve as the executive dean for the school. Here you can see the entire full-time faculty with the founding president to my left. They're now using a platform-based approach to provide state-of-the-art medical education, which was previously unimaginable in such a location. And you can see from the usage numbers that the institution and the students are embracing a whole new way to learn. 8,500 lectures, and you saw the size of the faculty. So how can they afford this? Well, the cost of a learning platform is about the same as 2 textbooks per student per year. And it has a complete didactic medical curriculum. So I know firsthand now that medical schools do not need to cost tens of millions of dollars. And they can be started almost anywhere. All you need is a decent internet connection, some willing doctors, and dedicated students. And these can be ordinary students, but they do have to be willing to work hard. So new ideas often bring out skeptics. I remember someone telling me that all I was doing was allowing second-rate students to become second-rate doctors. Well, I don't believe in second-rate students, and the education science doesn't either. Most medical students I have dealt with come from underprivileged backgrounds, but if they're properly motivated and they're given the right tools and guidance, they make outstanding doctors. So picture to my left is Raj. He was a student from the Samoa-based program. He'd always wanted to go to medical school, but he couldn't afford it. So he took a shorter, less expensive route to becoming a physician's assistant. When he'd heard of the program, he thought that he'd found his way to pursue his dream, and he signed up. It allowed him to do his coursework online and his clinical work in local community hospitals near his home in the U.S. I'll never forget a call I got from him. It was during his second year of training, and I hadn't heard from him since he graduated. You know, calls from students are sort of like calls from your children. It's generally not good news. So I get this call, and Raj, everything all right? Dr. Horneffer, I have to tell you about one of my patients. I admitted a patient tonight through the emergency room who'd presented there with back pain. They didn't know what was wrong with him, so they admitted him for observation. I remember you're telling me whenever I do an admission physical to always be very thorough. And I was checking his pulses, and his pulses were not the same in both his arms. I knew that this could be a tear in his aorta. So I ordered an emergency CAT scan, and it showed the tear, and I arranged for emergency heart surgery. Dr. Horneffer, I think I just saved my first life. Any doubts that I'd had before that your average hardworking student couldn't make an outstanding physician vanished. I reconnected with Raj just a couple weeks ago. He is now the member of a 9-member physician group. They have an innovative practice plan that he devised several years ago. They specialize in caring for patients with advanced chronic conditions and provide much of the care with in-home visits. And by focusing on preventative care, they keep their patients from making expensive and often unnecessary visits to the emergency room and hospital. He has not only found a model that provides better medical care, but he significantly reduced costs for the insurance company that had funded this demonstration project. So he's going to publish his results, and the insurance company is using this model now in its other markets. So we have a physician shortage, but we also have a solution. It needs patients instituting, as teachers, students, and regulators are going to need to get used to this paradigm shift, which will be required to change the medical education system. And if you know anyone passionate about going to medical school but can't get into traditional medical schools, please tell them not to give up. There are many new innovative programs that are being developed. And remember, next time you're in that doctor's office waiting, we have a solution to this problem. It's going to take a little time and a lot of effort and energy and many people working together to solve this problem, but we're determined to do it. So on that note, I better get back to work, and I appreciate your time.